Chris Storr says we should start, so we should. I'll call this meeting to order. This is the first legislative budget hearing for FY19. It's Monday, August 27, 2018. Time is 6:02. Roll call, please.
Anderson? Here. Clemens? Here. Clifford? Here. Coert? Douglas?
Here.
Eisenman? Here. Esri?
Here.
Furtado? Here. Goss?
Here.
Harper?
Here.
McGuire? Mitchell? Patterson? Petrie?
Present.
Quisenberry? Rector? Rosales? Storr? Summers? Tinsley? Vachaspati? And Weibel.
Present. Excellent pronunciation on that Vachaspati name, by the way. Okay, we have a quorum. Seek approval of the agenda and the addendum. Moved by Mr. Esri, second by Mr. Goss, and discussion. See none, all in favor? Aye. All opposed, motion carries. Okay, tonight's presentations will be almost all by Tammy, lucky Tammy. But what we're going to do is we're going to go through each item first, like county highway. We'll talk all about the county highway funds. Let her do it, and then we'll have questions afterwards. Everybody understand that? So basically, don't interrupt her for each item on the agenda. But as soon as they're done, then you have questions either for Tammy, or perhaps from a department head, elected official from that department. Okay, Tammy, you ready?
Yes, thank you.
Take it away.
One of the things that I want to start with before we get into the actual presentation, because we have some new board members, and we are going to be talking about budgets with property tax revenues, is I want to give a brief overview of how the county is preparing its levy in relation to the intention of capturing new growth revenue if in the event that there is a favorable ruling in the hospital property tax case. So we have done this for the past 2 budget years. There has not been a ruling in the case, and so when that is determined prior to the Board of Review closing the books, what we end up doing is we prepare budget amendments to remove the additional revenue and expenditure from the budgets. So in a nutshell, if there is a favorable ruling, then the hospital properties will be added back to the tax rolls. And if that happens before the Board of Review closes its books for revenue year 2018, under PTEL, the county can treat that equalized assessed value as new growth. And the EAV associated with the hospital properties is approximately $120 million. So it's a significant amount of property. And this will result in approximately $1 million in recurring revenue for the county. The thing is that this new growth can only be captured in the year that the properties are added back to the tax rolls. So that's why the county is being proactive in preparing its levy in this way, so that if it does happen, that we have prepared our levy to be able to capture that additional revenue. I did speak with the state's attorney's office today, and there is a trial set for the Carl case in January, and that's the most recent information that I have. If any board members have specific questions about this, Jill Fletcher with the state's attorney's office said that you're free to contact him to get some more details if you want to learn more about this. One of the things I want to make sure you are aware of is that in the event of an unfavorable ruling, the county's liability exposure is approximately $2.6 million. Of that, we have about $946,000 in reserve fund balance that was a TIF surplus released, and the auditor's office has reserved that in fund balance to offset this potential liability, but it's significantly less than the $2.6 million. And in conversations with the state's attorney's office, there's also possible prejudgment interest that could be added to that amount. So just want to make sure that everyone is aware of that. We'll start with the county highway budgets, and County Engineer Jeff Blue is here. If there are questions of him after the presentation. Jeff, would you stand up so that board members can put a face with a name. Thank you. County Highway has 5 budgets, and we'll start with the operating budget. This is Fund 083. Budgeted revenue and expenditure is $3.2 million for fiscal year 2019. And this budget includes an additional $76,700 in property tax revenue and road improvement expenditure associated with what I just discussed with you, the property tax, the property tax case. In 2019, equipment purchases that are scheduled are a tandem dump truck and a front-end loader. However, there are no major road improvements budgeted in 2019. A transfer of $104,000 is budgeted to the Highway Building Capital Fund. And the fund balance numbers that I'm providing tonight are fund balances projected at the end of fiscal year 2019. That projection for the Highway Fund is $1.85 million. County Building Capital was a new budget that was created last year, and the purpose of this was for highway facility capital projects. In 2019, there is a $104,000 transfer from the Highway Fund, and expenditure is budgeted at $15,000. There are no major capital projects scheduled in 2019. Basically, funds will accumulate until major capital repairs are necessary. And the projected capital balance at the end of 2019 is $174,000. That $174,000 is included in the fund balance that you saw on the previous slide. The County Bridge Fund is a property tax levy fund, and so there is an additional $38,000 in revenue and bridges and culvert expenditures in the 2019 budget. This is a balanced budget with fiscal year 19 revenues and expenditures at $1.36 million. There are 2 major bridge replacements scheduled and 8 minor projects scheduled in 2019. Per Mr. Blue, we are losing ground on our structural adequacy on the county and township systems. Many of the bridges were built 50 to 60 years ago with inferior materials, and the cost of bridge construction in the last 10 years has risen 75%, while revenue growth is limited to the property tax increase allowed under PTEL. The fund balance projection is just under $1.7 million at the end of 2019. The County Motor Fuel Tax Fund has revenues budgeted at $2.5 million in 2019 and expenditures at just under $4.7 million. MFT revenues have not been increased, or the MFT rate has not been increased since 1990, so revenues have been fairly flat in this fund. In 2019, County Road 9 from Ludlow to County Road 32 is scheduled for repairs, and that will be funded 100% with motor fuel tax revenues at $3.2 million. And the county's guardrail system will be upgraded. That will be funded with 90% federal safety funds at $2 million and 10% MFT funds at $220,000. The fund balance projection is $1.96 million at the end of 2019. And the last highway budget is the Federal Aid Matching Fund. Revenue is property taxes and interest income, and the budget in 19 is $109,000 with no expenditure appropriation. This budget includes an additional $3,000 in property tax revenue associated with a favorable ruling in the hospital property tax case. And the fund balance is going to be allowed to grow until sufficient funds are accumulated and leveraged to match a federal aid project. The fund balance at the end of 2019 is projected to be $202,600.
Questions on the highway budget? Mr. Goss?
Yeah, this is probably probably Mr. Blue would be able to answer this. I have a specific question on the front-end loader and how many hours are on it, what's the age of it, what's the condition of it, and how much of the 400,000 is the front-end loader?
Our loader is basically used in order to basically put salt in the trucks, and we do some other work with it, loading rock, loading boiler slag, but it's a 2002 John Deere. I couldn't tell you the exact hours on it, but the problems isn't really the hours on it, it's the amount of corrosion we have on the machine. We wash it all the time, but it sits in salt a majority of the time during the winter time when we're loading salt. So since it's 16 years old, the salt has really just kind of got into it and tore it up, basically. That's why we need to replace it. We were going to try to replace it this year, but didn't have the funding to do it.
Other questions? Mr. Anderson?
Mr. Blue, just a question on the county building capital. What are you anticipating for your needs for capital improvements in the buildings?
Well, when Dana had that study done where they came up with a deferred maintenance, they said the highway department needed about $300,000 a year over it. I think it was a 20-year timeline. Is that the right timeline? 10? So could be a roof, could be a heating and air conditioning system. I mean, it's whatever we need it for. Until we were paying off the bond on that building for 10 years, and now that we've been in there 12 years, we've been able to take that $100,000 we were paying towards the bond and put it into this capital fund, so that at some point in the future, a roof on that thing's probably, you know, hundreds of thousands, if not $1 million. So we got to kind of save up for those big events.
Thank you.
While we're on that subject, Jeff, funding for that can only come from property taxes?
We can build buildings with motor fuel tax money. I don't know if there's any statutory authority to use motor fuel tax for maintenance. We can use it to maintain roads and build roads, but I don't know if we have any statutory
Yeah,
authority.
that's wondering, obviously, you maintain roads with equipment used in the building, so I was
Right.
just wondering if that's a possibility. I mean, it's obviously depends how much money you have available, too.
Yes, right.
Okay. Ms. Furtado?
I see that in the county motor fuel tax that for this year, we have a $200,000 match to a federal grant.
Right.
And then we also have this where you're just trying to accumulate money for a future, I guess, project. And why are there two just separate funds for that? I couldn't totally follow, like, if we can match out of the motor fuel tax federal grants, but then there's also a fund specifically for matching federal funds. I didn't totally understand.
Well, the motor fuel tax is money that we can use to match federal dollars with state gas tax.
Okay.
And the federal aid is the tax revenue from the county that we can use to match. So we can use either one.
Okay.
Depending on the size of the project.
Gotcha.
Because we're using $350,000 out of the federal aid match this year.
Yeah.
So it's, you know, between the highway fund and the motor fuel tax fund, the bridge fund, the federal aid fund, we can use any amount of those to fund construction in different ways, depending on the revenue sources that we have available to us.
So it's just that for this year, you're using the motor fuel tax as the match and then just letting the other ones sort of build back up?
Right.
Okay.
Exactly.
Okay, thanks.
Ms. Petrie?
Would you mind checking to see if that motor fuel tax can be used for building maintenance, and just let us know?
Sure.
Okay, thank you.
Yes.
Anybody else? Steve, you're no highwayman, no questions?
In my opinion, motor fuel tax is best used for maintaining highways.
Okay, all right. Okay, with that, thank you, Jeff.
Thank you.
Let's move on to animal control.
Ms. Joes is here. If there are questions, Stephanie, please stand. Thank you. There are 3 budgets for animal control. The first one is Animal Control Administration. Revenues in fiscal year 2019 are $272,000. These are predominantly for fees paid for dog and cat registrations. And budgeted expenditure is $195,937. Ms. Joes has indicated that there will be new vaccination programs that will be implemented in 2019 to help increase compliance, and one of those efforts will be clinics for low-income residents to assist with tags and rabies vaccines. Also, the software that the Animal Control Office is using is on the AS400, which, as you know, the county is making efforts to move systems off of that antiquated platform. And so in 2019, Ms. Joes is going to be looking at software replacement solutions and perhaps see if we're able to implement those in fiscal year 2020. The fund balance is $230,500. The Animal Warden Services budget has income budgeted at $141,000, and the revenue is predominantly from intergovernmental agreements with cities and villages, and those contracts will increase 2.1% in 2019, which is the CPI. The county does not have contracts with Fisher, Mahomet, Savoy, and St. Joe. Expenditure budget for 2019 is $242,400, and one of the things that we are appropriating in 2019 is for the purchase of a van, which has approximately 300,000 miles on it.
Just a clarification question. Is it a full contract with both Champaign and Urbana for warden and impound services?
With the city of Champaign? I believe so. Is that correct? Yes. Urbana is impound only.
The rule is we're going to talk about the whole departmental budget first, then questions. Thank you.
The impound services budget has revenue of $187,000. Again, these are intergovernmental agreements that will increase 2.1% in 2019. And Mahomet and St. Joe do not have impound contracts with the county. Expenditure appropriation is $202,200, and this increase is partially attributed to the cost of an agreement with the University of Illinois that was implemented this year for surgical fees. And also part of this increase in expenditure is due to aligning the impound fee revenue with the fee distributions to the cities and the villages. And so all 3 of these budgets are the Animal Control Fund, Fund 091. So you'll see that there is a revenue to expenditure deficit for the impound and Animal Warden Services budget that is partially offset by the Animal Control Administration budget. However, in total, we are going to be drawing on fund balance in Fund 091 for the purchase of the van that was planned for replacement.
Okay, questions, Mr. Storr?
Thank you. I saw here it says the villages of Mahomet and St. Joseph have opted not to renew their animal impound contract. I wonder why that was.
Ms. Joes, could you speak to that, please?
In 2016, I believe, we implemented a new formula for figuring the cost of impoundment services for each of the contracting cities and villages. It is now based, it was previously based on a per animal per day amount, and it is now based on a population. So Mahomet, their cost for impoundment significantly went up, and they didn't have the budget to pay for the impoundment services.
So what happens to the animals that are,
So they are currently providing their own animal control services in impoundment. So they take care of all of that in-house. I don't have any knowledge of how exactly they're doing that, but if you do not contract with us to provide the service or the impoundment services, then it is solely up to that governing body to handle those problems.
do they have to comply with the same sorts of rules that Champaign County does, or?
Yes, under the state law, the Department of Agriculture oversees all animal control departments, and so they would be required, if they have a facility, to have the same standards that the county is required to have as well.
Is that also the same for Fisher and any other villages?
Yes, Fisher does have an impound agreement with us. They just do their own animal control services. St. Joe, Mahomet are the only two that don't use our, well, Bonneville and Homer we don't provide services for them either, but we haven't since the inception of the facility in 2006. But Mahomet and St. Joe, that's just a recent change.
Ms. Furtado.
To follow up on that, if we do have that arrangement with Fisher, why is there no projected revenue from Fisher in the budget?
I don't know. I'm sorry. That's for, yeah.
I'm sorry, page 21.
Is it lumped in with local government reimbursement?
It probably is. I think it may have been lumped into the local government reimbursement. So there's a line there that handles all of the villages that aren't individually listed. And I believe it may have gotten lumped into there.
We can check on that.
But I will check, Tammy and I will double check on that.
Other questions? I have one, the new van, will that for $6,000, is that fully equipped?
Yeah, it should include the taking it to Mavron to have the cages that we
Okay.
have our old van and put into the new
Okay,
van.
all right,
So,
very good. Anybody else? Okay, thank you.
thank you. Have a good night.
Next is Children's Advocacy Center.
Executive Director Carrie May is here tonight. And there is one budget for CAC. It is a balanced budget, with revenue and expenditure at $313,600. And one of the things that Ms. May mentioned was that the National Children's Alliance grant was eliminated this fiscal year, and so now CAC of Illinois receives funding and provides free training to CACs within the state. The CAC received in 2018 law enforcement donations that totaled just under $10,000, and also Champaign County Mental Health Board and Victims of Crime Assistance Grant revenues increase in 2019. There is an increase in 2019 for professional services expenditures, and these are for counseling due to an increase in the number of the clients that the CAC is serving. The fund balance projection at the end of 2019 is $41,500.
Any questions? Okay, let's move on to Board of Health.
One
Sorry, Prandal.
I know the public defender's budget has mentioned an increase in the need for translation services. I'm wondering if that is also an issue at the CAC?
So we do have that as a line item in our budget. It's funded by the VOCA grant. So we have a contractual translator that we work with. And then we also work with the Refugee Center that provides translations free of service.
Thank you.
Other questions? Ms. Douglas?
I noticed the line item for investigation in child abuse is 0. Is that being cut out?
Is that in?
55. Just investigation child abuse.
Page 24.
Oh, page 24.
Oh, for revenue. That was the National Children's Alliance grant.
Okay.
So they took, Children's Advocacy Center of Illinois took that grant away from all of the CACs within Illinois, and then have offered really low-cost trainings or free trainings for all of the CACs.
Other questions? All right, thank you.
Thank you.
Next is Board of Health.
Oh, Dr. Peterson is here. Dr. John Peterson, John, would you please stand so the board can put a face with your name?
John Peterson, the treasurer of the board.
And in 2019, the revenue is budgeted at $978,640, expenditure $993,407. This is a property tax levy fund, and so there is an additional $36,500 in revenue and professional services budgeted in the event of a favorable ruling in the hospital property tax case. This budget also includes an additional $25,000 for expanded services that were for services that were not provided in the current fiscal year. $15,000 of that is for expanded dental services for Champaign County Medicaid and Managed Care Organization eligible teens and children, and just under $10,000 is for teen pregnancy and STD prevention education in local schools. There is also $15,000 appropriated for services that are outside of the scope of the CUPHD contract. And these could be for emergency services, or for instance, in 2018, CUPHD did some additional investigation for the Board of Health related to the People's Gas leak in the Mahomet area and the impact on the water wells there. So this is an additional amount that is included to be drawn from the fund balance if necessary for emergency services or other services that were unanticipated that come up in the fiscal year.
Questions? Ms. Petrie.
Tammy, just for clarification and for those who might be listening, on page 28, that 533.7 line, where it's $100,000 more basically, and that folds back to your introductory explanation depending on how the decision goes in the Carl case. Is that correct?
It's approximately $100,000 more than the FY 2018
Right.
projection. Part of that, yes, is the Carl case. Part of that also is services that were provided by CUPHD. We aren't automatically billed for the full amount of the contract, but there are services within the contract that are budgeted, and if those services are provided, then they are billed to the county. So there was some underutilization, I guess, of the services that were provided through the CUPHD contract. This number actually came from CUPHD in regard to what they expected that the contract amount would be by the end of the fiscal year. It's just a projection, though. And part of it does have to do with the amount that was originally included in the budget associated with the hospital property tax case that obviously there wasn't a ruling, and we removed the additional expenditure and revenue from the budget.
Okay, so then can I fold back to 2018, those two columns, because there is basically a little bit more than 100,000 differential in that, so is some of that differential sliding over to 2019?
Are you still in 53307?
Yeah. I'm looking at 2018 original column and 28 projected.
Mm-hmm.
One is, the original was 945, and right now the projected is 836.
Right.
Okay, so if that differential holds, is the assumption that that differential will hold and it's sliding over into the 2019 amount?
That differential will hold in, I'm not sure what your,
Well, if they
That we're-
project in 945 and they're only using 836, were those real funds or just estimated?
when you're talking about the original budget,
Yes, in 2018.
they were estimated. I mean, the amount of the, excuse me, the amount of the services that are in the contract are estimated at the time when the budget is prepared. And so, for instance, and I don't have a breakdown of, maybe I do. Yeah, I'm not sure. So there was, I don't know if this is where you're going with that, but in 2018, there was an increase in the tobacco-free grant that we did appropriate for, that actually, I think you received those revenues early, didn't you?
Yes.
In 2017?
One time.
Yeah. So is that what you're,
Excuse me, yeah. The tobacco-free was a one-time grant.
Right.
No longer exists.
Right, right. I'll talk to Tammy about this later, rather than taking a lot of time on it now.
Ms. Furtado.
I have a question on page 29 about the fund balance. It says that your goal is to have a 25% fund balance of, but if I'm reading this right, it's 42% fund balance, and then even if you back out the Carl, it's a 40% fund balance, and then even if you back out the 25,000 contingency, it's a 38% fund balance. So is there a reason why, I mean, usually our fund balances don't hit our goals, and this one seems way above our goal, and is there a reason that that it's so high? Or am I not, or is there something I'm missing?
No, you're not. Historically, that balance, and it's not happening any longer, and I'll explain why, but that balance became larger than, it tended to be larger than budgeted every year, because when we did the property tax evaluation, the estimated evaluation between the district and the county, we tended to come out ahead. So we ended up adding to that balance that, is late in the year that we got that notice of beyond our start of our fiscal year. That's now reversing the last 2 years. So it's been, since I've been on the board, really, we had a favorable distribution of about 5% every year until 2 years ago. So there's more assessed valuation taking place in the city limits of Champaign-Urbana now than in the county. So our estimates have been downgraded in terms of assessed valuation. And that's how that built up over the years. And so the board looked at that specifically this time, and we took a look at several programs that had been proposed for funding or funding has declined. And so we took a realistic goal of about $25,000 a year that we would fund services that had been offered that are no longer funded. And so we did that in the teen pregnancy area, and then the district is now going to provide explicit dental services to county residents, that program we had not had in place before.
So do you anticipate that the fund balance will continue to sort of drop over the next few years to get it down to 25%, or?
We think it'll drop slowly.
Okay.
I've been treasurer for a while, and I'm kind of jealous of that fund balance.
Mhm.
And because there may be a time that we're going to need it.
Sure. I just didn't know if there were any direct services that we were not doing that could, if there was a reason why this fund balance was so large.
And that's what we've addressed this
Okay.
year.
And this fund balance, 25% of the expenditure budget, was established by the Board of Health. I don't know how many years ago, but, and that's approximately, I think, $250,000. If there were a true large-scale public health emergency, that amount is, probably a drop in the bucket compared to what true costs could be.
Mr. Goss.
Thank you. I did a little research this afternoon. I can't quite get that 933,000 to tie out to the CUPHD budget. They show county services at about 734, and so I'm wondering if I'm missing the other 200,000 somewhere else in their budget.
So the total expense plus emergency fund is 951,000. So I'm working off of the CUPHD budget proposal. Are you talking about revenue in CUPH? Okay, I haven't seen that.
Yeah, I went and they approved their budget, I don't know, a week or so ago, and they show county services funding revenue at 734,000, and yet we're at 933. So I'm wondering where that.
I haven't seen
199.
CUPHD's budget other than the budget that was prepared for the Board of Health to fund CUPHD. So I can't speak to that, but I can look into that. Dr. Peterson, do you have any insight?
I would put that into the category of a good question. Yeah, because that's not the figure we use.
Sorry, Mr. McGuire.
Thank you, Mr. Chairman. Dr. Peterson, thank you again for coming in front of the board and your service to the board. Obviously, I have these perennial questions. I have the same question as Furtado has. I feel that the reserve has been way too large for too long. I think the levy's too high. I think it should be adjusted. We may be providing more service this year, but that should have done long ago. Those changes should have been done long ago. We've asked over and over again for additional inspectors for the county areas. I guess I have a question about where the additional services are going to be and what required those services, the need. The dental services I understand. I want to know where the services are going to be the additional services going to taking place. Is this just a reason for maintaining what is an unbelievable number for a reserve? There could be possibly something that might happen in the county, but obviously if it's big enough, we're going to have to subsidize it anyway.
Outside the dental services, the additional program is teen pregnancy, and that's going to occur in the county schools.
I believe there's other providers for some of those things, but I'd like to know if you've seen something happening that requires that we provide those services also. Is there a major increase? What has required these services? That the health department start doing that rather than the services, the long time period for inspections for restaurants, the things that we've indicated in the past that are an issue. I'm not against this, the STD training and pregnancy training. I'd like to have more information about what brought it about, other than the 38% reserve and an expected request for a 4% wage increase.
With respect to the teen pregnancy, as my understanding, these were services that were funded previously under grants that are no longer continued. So this was replacing funding for a program that already exists in some form. The dental is new, and there's an unmet need across the board. Now, Francis Nelson provides a measure of services directly by in-house dentists. In fact, I think they have two. But the Champaign-Urbana Public Health District also employs dentists, and they have been focused on city or district dental care. This is going to allow us to expand into unmet need in the county. And that the dental part of it is two-thirds of the 25,000.
Well, and if I could add to that, from attending the meeting, it sounded like some of the Champaign County children were being referred to Douglas County because they were having difficulty finding provision for the services within Champaign County for Medicaid and MCO eligible services.
Correct.
And in regards to the STD and teen pregnancy prevention, the grants, I think, were pretty strict and stringent in regards to the number of hours that had to be provided to the schools, and some of the schools felt that it was too many hours, so they aren't eligible to receive any of those grant services. So this funding would allow for there to be a scaled back service of providing this education and training in the schools.
Yeah, I think as the staff member indicated that no funding was available for any program that didn't take an 8-hour day. And this was difficult for the schools to fit into the curriculum. So this is giving this program more flexibility.
Mr. Clemens, do you have a comment on that?
I also believe that there was a stipulation in the granting, for the grants, that there had to be a certain percentage of minority children in that school district as well for them to qualify. So this is just meeting a need that's no longer met because the grants have been removed for the county schools.
Ms. Petrie?
Back to the dental clinic situation. Now that Presence is OSF, is there still dental clinic provided at that facility? Well, there was one at Presence, but when OSF took it over, did OSF keep it?
I don't have a good answer for that, and in fact, I wasn't really aware of much being done by Presence. There was funding of Francis Nelson by the clinics for dental care.
Okay.
Not aware of, and I could simply be wrong about that. I was not aware of any dental services being provided by Presence, since there are no dentists or medical staff at Presence.
Okay, well, so where I'm going with my question is, I don't question that there's need at all. What I am questioning is if it still exists at OSF, and they do have dental equipment in that section of OSF, is there any reaching out and collaboration to find out exactly what the need level is so that this funding isn't just hit and miss and that it's done in a more gestalt manner?
Well, the district has, in terms of the services it's been providing, has direct knowledge of the need simply by not being able to meet it. As Tammy mentioned, there were referrals being made to Douglas County as a result of our inability to provide the services directly. So that, I don't know that a survey had to be.
Okay, but is there any collaboration between public health and Promise?
Yes, there is collaboration between the two, although the funding, there is
that was my point.
Collaboration in terms of referral back and forth, yes.
Okay.
Ms.
Promise has a mandate to
Ms. Eisman.
Hi there. I just have a question. Who determines the curriculum for the teen pregnancy and STD prevention that's taught in the schools?
my understanding is that it is largely determined by the grant and the school districts. So in other words, there are stipulations in the grants that have currently been applied to that program prior to our funding it. The curricula that will be expanded or the more, let's say, more modifiable or more restrictive curriculum that will be developed for this program will be put together by staff and school district staff.
So this will be different than like what's already taught in school health classes.
It's not going to be as restrictive as what's already being taught.
And what do you mean by that, restrictive?
Well, restrictive is, as Bradley pointed out, is that this grant that existed prior to it was restricted to programs that took at least 8 hours and also included a certain number of minority children. And that excluded a number of the schools in the county from getting that money.
But so my question is, so this is in addition to, like, they already have health classes, like in junior high you have health in 5th grade or 6th grade, 7th and 8th grade, and then in high school you have health classes that has sex education and STD preventions and all of that. My son will be learning in 8th grade. And so my question is, so this is in addition to health, so they have health and learn about it, and then this is in addition to that? Okay. And so do the classroom teachers administer this, or does somebody from the health department come in?
I believe both.
Okay.
Definitely involves some of the health district staff.
There was a work plan for this proposal that we can email to you so that you can see what the items that are identified for instruction are.
Ms. Furtado.
Sort of piggybacking off of Mr. McGuire's comment, I think the reason that the high fund balance caught my attention was, one, because of the conversation that you all have had about the wait time on inspections. The other is the opioid crisis, and I was curious, talking about preventative services if a county community health need exists, and we've heard in this body about the opioid pressing need, right, and its impact both on law enforcement but also right on health. And we're sitting on this fund balance and this crisis is going on, but I don't see anything on here that addresses that. And I just was curious if that was part of the conversation at all.
Mr. McGuire.
Thank you. The discussion you just presented, are you talking about the Champaign-Urbana Health District or the county health district that's done those things? I don't want to conflate it. As, okay. Okay, just want to make, okay, because I mean, that's why I think Patsy and others are talking about not siloing money through different departments and different organizations throughout the county, and who's doing work and who's funding, you know, different things. I know Smile Politely does some programs in the county, smaller towns. You know, we don't want duplicated work throughout the county when it's pregnancy issues or STDs or whatever. I think we may have some issues with small towns and additional sex education that might be going on. That might be something that might come up, and maybe a question that's coming up now, greater than what the school boards have determined for themselves. So that's why some of these questions, I think, and spending more money might be an issue, because I think the state and the federal government will be coming up with more funds and more grants for the opioid issues, and we want to work together to try to accomplish some of these issues. So maybe a little confusing there, but at the same time we have to all work together, not just add another program in the county, although I want to see them served.
Mr. Vashapati.
Yeah, I just sort of have a similar question to what I asked of the CAC. Do you folks have outreach targeted at folks who might not have English as their first language, and are you sort of seeing an increased need for those services? Thank you.
Other questions? I have one comment about the salary increase that Mr. McGuire mentioned. It's largely dictated by the salary increase of the public health district, which we contract to. You realize their budget is about $12 million, of which $1 million contract from us. That's about 8% of their budget. So I don't know how you would sort of figure out have differences in the salary increase. I mean, this is a lot of medical people there. They're competing with the hospitals and clinics, things like that. So they want to keep their staff happy. So, I mean, they're not going to look at the county cost of living or the county increases. They're going to look at other areas for cost of living. This year they decided on 4%. And they do compare what their employees are getting to other entities like that. Just thought to put that out there. Remember, their budget's $12 million. It's a lot bigger than our part of it. Well, you know who to complain to about that. Okay, let's move on to GIS Consortium.
One point of clarification I want to make, that salary increase for 2019 was actually 3.8%. I know it said 4%, but I think there was a decimal that was left out and it rounded up if anyone saw that worksheet that was provided by CUPHD.
Ms. McGuire?
Well, that'll be a concern for our own wage increases throughout the county then if this department is getting a 3.8% increase. I'm sure everybody will take notice of that that works the staff. So
Those people are not our employees, though.
Ms. Riley is here for the GIS Consortium budgets, and there are 3 budgets. Starting with the operations and administration budgets, revenue in 2019 is $553,000. This is from member contributions, which will increase 2.5% next year, and budgeted expenditure is $552,600. The GIS Policy Committee has approved this budget at its July 20th, 2018 meeting, and the small member contribution increases are necessary to cover increases in personnel costs and also non-personnel costs. The fund balance at the end of 2019 is projected at $322,800.
Questions?
Oh, I'm sorry, I'm not done. I couldn't get the slide to move. The capital and technology budget has revenue at $61,000. This is from a transfer from the budget that we just discussed. And expenditure is $79,025. The purchases that are made from this budget are based on a 5-year capital and technology plan, and so some years the revenues will exceed expenditures, and in others expenditures will exceed revenues, as in 2019. And those are the purchases that are scheduled are based on the outline in the capital and technology plan for the GIS Consortium. The aerial photography budget is the last budget, and revenues are $31,750. Budgeted expenditures are $0. Contributions to this budget have stayed stable for the past 5 budget cycles because acquisition costs have remained stable. And basically, member agencies make an annual contribution for 1/3 of their share of the cost for aerial photography. And then in the 3rd year, there is an expenditure budgeted for this aerial photography of the county. That last occurred in 2017 and is scheduled for 2020. Oh, the GIS fund is actually separate from the consortium. I can go ahead and cover it because, while Ms. Riley is here in case there are questions about it as well. So the GIS fund actually pays for the county's annual membership to the consortium and for its portion of the aerial photography. And revenues from this, for this fund are from fees for documents filed and recorded. They are budgeted at $332,500, and expenditures are budgeted at just under $320,000. The expenditure budget also includes an additional $10,000 for a potential opportunity to update the county's LiDAR data in conjunction with FEMA. This was last done in 2008, and per Ms. Riley, FEMA has indicated that Champaign County is a priority county. We're not certain that they will come in and collect this data, but if they do, it may not meet the county's specifications. And so there could potentially be an opportunity for the county to buy up and request the data that meets the specifications. So this additional $10,000 is actually for what would be the county's portion of this buy-up in the event of this LiDAR collection of data by FEMA. And the 2019 membership fee increases 2.5% as the other membership increases as well. The fund balance at the end of fiscal year 2019 is projected at just under $344,000.
Questions? Mr. Vashapati.
Yeah, I'm just wondering to what extent the, I know ArcGIS, ESRI is the sort of state-of-the-art in GIS software. I wonder to what extent the GIS consortium has explored the use of open source technology that may be cheaper and
that will be a question
so on.
for Ms. Riley.
We looked at it pretty extensively this year, but there's so much interaction between the different agencies that are member agencies. Oh, sorry. There's so much interaction between the other member agencies and the consortium that it would be very difficult unless the other member agencies choose to switch, for us to switch as well.
Yeah, thanks. I understand.
Mr. Storr.
Thank you. Are future aerial photography collections going to include the infrared channel? I don't think that there was infrared on one of the collections.
In 2017, it did include the fourth band, so we did collect infrared in 2017. But I think prior to that, the last time we collected was, I don't know, maybe 2005. But now the cameras are equipped with it, so it's the same price.
Mr. Anderson.
If you could just educate me on our member agencies' contributions. When I look at this, Champaign County contributes 62%. Is that because we're receiving fees?
Yeah, so the state statutes have a kind of a way to collect money to fund GIS within the counties within the state of Illinois. So when the consortium was put together in 2002, that was just the way they chose to do the funding. So the bulk of it comes from the county due to that recorder's fee that is in the state statute. And then the other member agencies, I wasn't around at that time, but they agreed on a base cost and then a per capita fee.
Thank you.
Ms. Petrie?
Oh, well, Mr. Anderson asked my first question, and that's the disproportionate amount that the county pays in. On line 5337, professional services, in 2017, it was $107,000, and now projected for 2019 is $2,000. What changed in your office?
That's because in 2017, we collected the orthophotography. So
Okay.
every third year, that line is going to jump.
Okay, all right, I got that. And this is a general question, a statement about the budget presentation to us, and it happens to turn up on your budget. It isn't directed at you, and it has to do with line 511-3 on page 34, and Ms. Ogden and I have already talked about it. I request it every year, and that is the salary line is aggregate of all the employees in the office, and I have requested every year that at a minimum, the head of the department or the elected official or whatever gets pulled out, so we have a better chance of delineating the aggregated amount. And I apply this to all the rest of the budgets in which the salaries are in this format. Thank you.
Mr. Storr?
Thank you. Ms. Bria Riley, what postings will a new LiDAR be flown at? I mean, what does FEMA fly, and what are we asking for?
Well, if we get chosen by FEMA, the advantage will be that they'll put up the bulk of the money. But FEMA flies at different standards than the USGS. So we would fly, I think it's the USGS Q1 level. And so that, I mean, so we would essentially pay to get the data upgraded to that level. So your densities will be a little higher. They'll use the accepted classifications of the points, so you won't just get, all FEMA cares about is the ground. So you would get the, first, second, third, fourth returns if we were able to do the buy-up. And the city of Champaign and the university have voiced that just the FEMA standards, I mean, it's not going to meet their needs for what they would use the data for, so.
This can be pretty important for a very flat area such as ours. What is the target spacing that we're looking for?
I think the Q1 is 3 points. Gosh, I don't remember, but I think it's 3 points per square meter. Is that what you're asking?
Well, I was just kind of hoping it was an improvement over the 1
Oh,
point per
yeah,
square
no,
meter.
it'll be an improvement over what we had. Yep, absolutely. So I think it's about 2 or 3 more points per square meter than what we have.
Can I ask a geeky question? Are they still going to be using the pulse method, or are they going to try, or do you know if they use some of the photon or other exotic methods that are being tried?
Yeah, I won't know exactly, because if we go through FEMA and the USGS, if that works out, then we have to use their vendors. So it would be whatever they would present to us. So I don't have an answer for that. I wouldn't know that until a contract is put together.
I do hope you'll come back and let us know.
Mr. Goss?
Yeah, this has to do with the fund balance, particularly on GIS fund, it being 100% of the expenses. I mean, that doesn't seem to be a standard. Is there something we're holding back? Is there something we're saving for? Because at 100%, it seems like we shouldn't be carrying that kind of fund balance.
I'm not 100% sure when that was established. I mean, it's documented here to offset years in which there may be major capital purchases or years in which revenue is substantially diminished. I know at one time that the GIS fund was struggling, and it was difficult even for the county to make its membership contribution to the GIS consortium. So this is something that I don't really have great insight to. What was the establishment for the fund balance threshold?
Well, I mean, it's obviously growing at a pretty good clip now. So, I mean, I think at some point we ought to start to maybe wean it back a little bit.
And that fund balance is going to vary from year to year based on, it's based on what's recorded, so property transactions. So when we're in high years where there's a lot of property transaction, you're going to see that fund balance grow. When you're in years when there aren't any or very few property transactions, which we just kind of went through, then that balance is going to drop significantly. So I think it's there just as kind of a safety net, because those property transactions are unpredictable. It's your fund.
Any other questions? All right. Next up is Mental Health Board.
And the executive director of the Mental Health Board and Developmental Disabilities Board is Lynn Canfield. There are 3 budgets associated with the Mental Health Board, the DD Board, and the SILA. The first one is the Mental Health Board. Revenues are budgeted at $5.4 million and are balanced with expenditures. This is a property tax levy budget, so the amount associated with a hospital property tax case is $142,500. And for the administrative costs, most of those are shared with the Developmental Disabilities Board through an intergovernmental agreement and a transfer of funds from the Developmental Disabilities Board to the Mental Health Board. Ms. Canfield has provided a summary of the programs that is included in your binder, so you are able to review those programs at a high level. Something else that is appropriated in the Mental Health Board's budget is a transfer to the SILA budget of $50,000. And there are efforts in 2019 to focus on resource information and coordination, also evaluation of program outcomes and decreasing stigma in 2019. The Mental Health Board is conducting a community needs assessment in the current fiscal year that will inform the strategic plan for fiscal year 2019 through fiscal year 2021. The projected fund balance at the end of fiscal year 2019 is just over $3 million. And I skipped over the first bullet point. The Mental Health Board supports agencies that provide services to people with behavioral health conditions or intellectual developmental disabilities, and also funds peer support networks. Again, the level of program detail is provided for you in the binder provided by Ms. Canfield. The Developmental Disability Board is also a levy fund. The amount associated with a hospital property tax case is just under $119,000. This is a balanced budget with revenues and expenditures at just under $4.2 million in 2019. Again, there is a transfer to the Mental Health Board budget for sharing in administrative costs through an intergovernmental agreement. The Developmental Disabilities Board funding supports agencies that provide services to people with intellectual developmental disabilities and parent support networks and self-advocacy groups. There's also a $50,000 transfer budgeted in this department to the SILA fund. There are efforts to focus on resource information, coordination, community awareness, and collaboration, and also promoting inclusion in 2019. And again, the strategic plan that is being worked on this fiscal year for 2019 to 2021 is also something that board is working on. The projected fund balance at the end of 2019 is $1.9 million. And the Community Integrated Living Arrangement Facilities Fund has revenue budgeted in 2019 at $123,300 and an equal amount in expenditure. The increase in expenditure in 2019 is due to an increase in appropriation for appliance or facility repairs that may become necessary. Revenue in this fund is from rent, interest income, and transfers from the Mental Health Board and DDB board budgets. And expenditure is for mortgage principal and interest payments. And what the SILAs do is allow for 7 to 8 individuals to live independently in their home community. The houses are accessible and in safe neighborhoods. The projected fund balance at the end of 2019 is $182,000.
Questions? Mr. Goss.
Yeah, same question goes for all three of these funds. I mean, we're talking 56% reserve, 45% reserve, and we're transferring 100,000 to SILA, and they've got a fund balance reserve of 150%. Seems like we probably ought to be looking at a little less.
Part of that has to do with the funding cycle, and these grant cycles are July 1 to June 30th. So you'll see a large fund balance at the end of the fiscal year, which then will diminish until we start receiving property tax revenues in May.
Sorry, are we gonna be that close to running out of money? I mean,
because so much of this work is contracted out to agency providers, and the payments for most are going out in 1/12 amounts. Because we hit such a low point in all the balances in May, we don't even do a payment in May, we do a double payment in June in order so that we can hold it as close as possible. There are different functions for the fund balances in the 3 different programs. The SILA one is probably the simplest for me to explain. This SILA project was initially to support the purchase of 4 small homes, but 2 things happened. A minority of board members expressed significant concerns about liabilities and didn't want to get into owning properties at all. And so we started to be careful about holding enough money in the event. These are group homes for people with significant disabilities, so I think they were thinking about really adverse incidents as well as problems with the houses. So the second thing that happened was more about the houses. We found we needed to do much more repair and remodeling to bring things into line with the state's regulations, which are some of those have been challenged in court, and the state is maybe going to have to lower some of the high bar that they set for people with disabilities, which they don't set for housing for people who don't have disabilities. So maybe we went through that because at the time that was the law, but those significant remodels cost a lot, and now we watch one of the homes that didn't have as many remodels now requires some repairs. So that's the reason to keep some extra money for that. But we may need to really re-examine that. I would like to take that issue back to the boards at some point and go back to the original intent, which was really based on a very deep unmet need in this community and throughout the state for small group homes for people with significant disabilities. It would be great for them to own 4. But I had to respect the concerns that were brought, even though they were not majority. They were really important things. So that's one fund balance. The issues around the mental health board and the DD board fund balances are a little bit different. The first is what Tammy explained. The majority of these funds go out in a different cycle than the revenues are deposited, so we have to be careful about what happens in May. But even then, it's possible that we have, at this point, more in one fund in the mental health board fund than is needed, and less in the DD board fund. The DD board fund gets really close to 0, and then the fund goal is to have enough money to pay out for 6 more months. If there was no more money, if we had to close up shop, to be able to pay the agencies for half a year of these services, because they are serving so many different needs and different populations. So that's, even beyond that, there might be a little more than we meant to have, and that's related to a perfect storm from the last few years, which was the small piece is that our administrative costs went way down, and that's because of 2 retirements, then some vacancies, and then, as we've gotten things rolling again, we find ourselves at much lower personnel costs, and we got a gigantic refund related to some office equipment, and we also brought in lots of surprise revenues related to our anti-stigma events. So that's a little piece of it. The bigger piece of it is that we monitor the agency performance on the contracts, and then, so in July, they start looking at what they accomplished the year before, and then through the independent audits, we identify excess revenue. So a whole bunch of revenue came back that way over the last couple of years as we're monitoring the performance of the contracts. So this was not intentional, and I think that I've had conversations with our board executives, but not with the board yet, about what they might do to spend a little bit more. I think that more money into agency contracts is always the preference. the Mental Health Board has spent the last 2 years really revamping the way they do allocations of contract for agency contracts and into a much more involved review process. So I think the next wave would be to suggest what are the kind of things that you would invest in one time, like what special initiatives or infrastructure or capacity, or not capacity, but capital improvement grants would be appropriate in the normal allocation cycle. So we're working on that.
Ms. Petrie.
Hi, Lynn. Thanks for coming. I have a number of questions. First, to Tammy, on page 45, Lynn's salary is broken apart from the others, and that's how I'd like to see all of the budgets set up, because that makes it very useful and helpful. I am glad to hear you talk about what it takes in money to run the office. But my calculation is right now it's at 10%. Do you agree with that calculation? 10% of the money of your total budget goes for running the office.
That's of the Mental Health Board budget. So the same staff and the same administrative costs are shared with the TD Board. So if you put the revenues together, it's less than 6%. I think it's around 5% that's personnel, and then the other administrative costs.
Okay, so it is lower than.
But you might be right that our total administrative costs are at 10% of total revenue. And we had gotten some advice last year through an organizational assessment that this is not enough. But I don't think we want to grow the administrative costs.
Well, my goal always and your money is growing every year, and you've told me that, but now I see it in print. So I always like to see as much of it as possible goes to the agencies. So my questions or my comments are within that framework. I looked at the total dollars appropriated, which is roughly 4.3 million, and then if I add in the staffing, it only came up to about 4.88 million. There's a little gap in the amount. Maybe that's just some other expenses that I didn't add into it. All right. I really appreciated the matrix you provided for us and what each of the proposals, the direction of the proposals and the amounts. And it did allow me to do a little adding. And you and I have had many conversations about my concerns. Again, it's extending the tax dollars as far as we can extend them. And I still would encourage the Mental Health Board to continue in the direction of looking at overlaps and efficiencies and how they launch the request for proposals to maybe get more agencies collaborating and working together, where one agency might not be able to respond to the initiative put forth by the board. The board never puts an initiative forward. The board just says it's proposal time and submit your proposals, whereas when I read the statute, really the Mental Health Board has much more authority to be a driver, and we all agree we need mental health services in this community. There's no question about that. So how are we going to go about getting money to do it and the leadership to do it? So as I run through the amounts here, some of them are staggering as to how much has gone to Rosecrans and how much goes to Developmental Services Center. And again, it's not because I don't recognize those needs. I'm still continuing to focus on, are we sure that we're doing everything in the most effective and efficient manner possible to service our community, because right now we're not accomplishing that. That's a comment, not a criticism. We all know We all know that, so I hope you will take that back to the board, that I'm still on the same theme. And then I do have a question about the SILAs. They're wonderful, and I haven't been to a board meeting in quite a long period of time, but when I was attending, there were issues about finding staffing for the SILAs. And are you all still facing that challenge? Yes, okay. For the record, she's nodding her head yes.
I'm sorry. So don't be surprised, but I can talk about this all day. So if anybody wants to talk to me about these things anytime, that's what I like to do. And I would say that the workforce shortage in developmental disability services started longer ago and has caused much deeper despair in this country and in this state than the other workforce shortages, which are now seen as crisis, and lives are at stake because of the behavioral health workforce shortages and the professional behavioral health. You know, the shortage of psychiatrists is now a global problem. So this is. We don't really know how to solve that problem. And so some of your comments, actually, you know that some of those ideas are familiar to me because we've spent some time on them. I think that our first run through this individual needs assessment, which we conducted mostly online during the winter, showed us from the perspective of people who need the services, what our system weaknesses look like. So we've been working on a whole bunch of different angles on this since then, and these are not things in this report. They're also, right now, sort of I'm testing out the waters of some more significant collaborations with other partners, consolidating the needs assessments, and maybe working to have one health plan for the region. So that's one experiment. We're also working on hosting a series of trainings for case managers and other support staff who might not have opportunities for trainings, so that they would have opportunities not only to learn from important professionals on important topics, but also just to be together for a couple of hours every month to network and learn about each other's programs. So that's another, it's new. I think that these problems are pretty well known. You've all mentioned them to me in one form or another over the years, and we're really trying to look at them from different approaches to solving these problems. That it is absolutely a problem that we don't have great coordination and collaboration across all the entities who are in the mix trying to help people. So that's been the theme of all summer.
Well, I'm glad to hear that, and that folds back to my concern that the monies are used as effectively and efficiently, because the two funds together are over $9 million, and that's an impressive amount of money in which the two boards could really leverage tremendously. Thank you for your answers.
Ms. Eisenman.
Lynn, I'm brand new to the board, so excuse me if everyone else knows this answer, but your homes, they only have 4 in each one, and so that's only 8. How do you select who gets to live in the homes?
We don't.
Oh.
So what happened is that the state of Illinois is under a consent decree. Well, it's a class action lawsuit to develop more, and they're required to develop more small settings and bring people out of institutions and out of their homes where they're not getting any services at all. So there was a moment in time where two state agencies and the governor's office were very motivated to work with us to develop that housing. So we don't decide who lives there. The state awards to people who are on their waiting lists, whatever, it might be as low as $50,000 a year to support them 24 hours a day and all sorts of different activities. They'll make those awards to an individual. For our purposes, those are Champaign County residents or the children of Champaign County residents who want to return home to be closer to their families. But an agency, an agency called Individual Advocacy Group provides the residential and day services to those people. So they are very small. It's 7 or 8 people total right now, and it would be great to build that a little bit, but we run into the problems of all of the agencies providing residential and day services struggle to keep staff. So then you have a group home with people who have not enough staff on at any given shift, or who are working double shifts because someone didn't show up, or it's so it's been so even though we have the capacity to make it a little bit bigger, twice as big maybe. We've been really cautious about moving ahead in case that causes more harm to people.
Yeah, that's wise. Thank you.
Mr. Vasapati.
Yeah, thanks. It's likewise my first time doing one of these, so I may have questions that other people know the answers to. First, these grants, are they allocated through a competitive grant process? Okay, and what's like the funding rate on those?
What's the what?
What's the funding rate? You know, how much money is, you know, requested compared to?
It's open-ended. We have, each board sets different funding priorities each year. They don't tend to change that much from one year to the other, but so then agencies are free to apply for whatever they think is going to best align with those funding priorities. So there's no limit.
Yeah, I mean, this is sort of in relation to Ms. Petrie's question. You know, you've allocated, you know, $3,500,000 for you know, one of these portfolios, and you know, how much money was requested in grants for that?
Oh, I understand.
The funding ratio.
Okay, that one was very close to 100%.
Okay.
We got very close to being able to allocate to everything requested for that one. For mental health board, we were under by about, I think the requests might have been $500,000 more than what we had.
And so I wonder where there's, you know, 100% funding rate, is there something being done to, you know, go out and find more proposals? Because, you know, if there's 100% funding rate, then just whatever people are asking for, they're getting, and you're losing that sort of competitive, you know.
That's a really future question. It's a really good question. We're actually looking at our audit policies to see if we can create a policy which accommodates much smaller organizations, so that, you know, to encourage applications from smaller organizations. Our audit policy right now is pretty hard. For an agency with a budget of less than maybe 200,000 is going to really struggle to pay for the type of audit that we require. So we're looking at changing that policy. We also, what's the other? Oh, we're also looking at our application process to see if we can make it a little bit more flexible.
Okay.
Yeah.
Yeah, because, you know, I'm used to funding rates of 10 or 20% for grants in the sciences, and so it's, you know, different.
On the other end of it, we have a whole new compliance requirement for the DD contracts. We actually know exactly who's being served across all the agencies, and we can see how many hours of service they're getting from everyone and what type of service, so that we can take that, you know, the higher look and say, well, you know, looking for overlap if there is any. So, yes.
Yeah, and I just had one other question related to, well, two questions related to the CELAs. What would you say is the unmet need for CELAs? Like, you know, if you could fund as many CELAs as you can, how many people do you think would be able to take advantage of those?
Oh, I love that. I think I haven't asked lately, but the Regional Planning Commission actually keeps the data on who is waiting in Champaign County for small group home. And you guys don't know.
I mean, are we talking tens of people, hundreds, thousands?
In Champaign County, we're probably not that. It's probably 30 people at the most. Okay. But if we were able to also, you know, my dream would be to be able to offer housing for people with behavioral health conditions too. Right. And I don't even know how many people might benefit from that type of. Okay.
And given sort of the liability concerns around CELAs, have you, you know, looked at working with NGO or, you know, nonprofits or private, you know, working with non-governmental organizations to provide those services, if you're not sort of, if there's resistance to doing that internally on your board?
The residential services are provided to the individuals by a nonprofit private organization.
Okay.
That was through an RFP process with us that they were selected.
Sure, but in terms of, sort of shielding the fund from liability by having the properties owned by.
Oh, I see. Yes. There are at least 2 board members who might like to take a step like that, and there has actually been talk of selling those homes.
Okay, yeah,
Yes.
because I think if there's 30 people, that's sort of, 3 times as many as there are currently being, housed, so. Yeah, of course. Of course, there are always going to be, issues, but, yeah. Thank you.
Ms. Furtado.
Returning to Mr. Goss's question about the size of the fund balance, you indicated that at least in one of the cases that the part of it was money coming back that wasn't expended. Do you know about like what percentage of money wasn't expended? And is that always been the case, or has that been because you like you were saying that you're doing more auditing? Do you know?
I think the driver, so it's different every year. There's always something comes back.
Sure.
But there were 2 years where it was a lot. And I think one of the drivers was really unfortunate. It was actually not us doing a great job of monitoring. It was actually agencies going out of business and not being able to use.
Okay.
Right? And then
Gotcha.
also not being able to staff the programs and owe us money back. That was most of the money was not being able to staff the programs, and our
Sure.
contracts are pretty tightly associated with staff
Sure.
to provide a service, so they had to send it back.
Follow-up question for that is when an agency receives a grant, do they receive all of the money up front? No. So no, is it reimbursable or is it
No,
allocated periodically?
It's monthly payments.
Gotcha.
And we
Okay.
have quarterly, there are several reports that agencies provide to us quarterly so that we can look at performance on behalf of people and then the financial status each quarter. So we do desk reviews there. Then there are some things that we ask, so we also do an annual site visit to each. Then there's an annual independent audit, which we look at for indicators that maybe excess revenues owed back. And we also, there are some things that we just ask for periodically.
Gotcha.
Compliance bits like certification of liability, 990s.
So I guess what I was trying to get at was if there was revenues coming back from people, like you said, that either went out of business or couldn't find the staff, but then there were unfunded portions of other, like another agency asked for X amount of dollars, but then didn't get it, would there be a way to direct those funds to the agencies, or is it only going back? But I guess on an annual basis, that might be hard to sort of make those midstream sort of changes.
So far, yes, it has seemed hard to do.
Yeah.
I think that it would be nice to figure out how to do.
Yeah, on
those
such a
things.
tight
Yeah.
funding, on an annual funding cycle, I think it would be hard. But I didn't know if that would be an answer, instead of
Right.
it falling back into fund balance,
Right.
but towards Patsy's point, making sure as much of it goes to,
Right.
too. But
Mr. Storr.
Thank you. I'm glad to hear about the interest in changing the auditing procedures for the smaller groups, because the accounting firms want a whole lot to prepare the compliance documents.
We've gotten a whole lot of expert advice on this issue, and I've kind of gotten to the point where I feel like if we stay with our policy, then it's very careful, and I like that it's very careful, and we're trying to be accountable for tax dollars, but it starts almost to look like, a lot of our tax dollars are going into auditing firms, which that's not what these funds are for. So we're working on it. We really do need to define some new processes, and so I appreciate that input.
Any more questions? All right. Thank you, Lynn. Ready for regional planning?
It will be difficult to break in the middle of regional planning, so I don't know if it would be appropriate
Do
time
we
for
want
a
to
break.
take a break now? Okay, let's take a 5 or 10 minute break. Okay, why don't we get back to work here? Next up is Regional Planning Commission.
And Chief Executive Officer Delitso Solomoya and Chris Ward are here to present these budgets.
I want to point out that for those of you new, Delitso's name, just pronounce it like you see it. Again, pretend it's German. Pronounce every word, every syllable. Tell them how to pronounce your name. Also, Delitso, would you mind mentioning why Betsy's not here? Because Betty's not here. She's not retired.
It's working? Okay. Thank you, Mr. Chairman and members of the county board. It's Delitso Sulamoyo. Yes, and I'm here with Chris Ward. She's our fiscal manager, and she's here in place of our Chief Operating Officer, Betty Murphy, who had a little accident a couple months ago hiking in Colorado. So she has been at home recovering and regaining her strength. We're hoping that she'll be back on a part-time basis the beginning of next month. So, yeah, it was. We had two RPC employees that broke their legs in Colorado all in the same year. John Dimmitt was one. He went out skiing with the high school kids in January, and he broke his leg. And then Betty was out there in July?
Early July.
Early July, and same thing happened. So, and then I'm going to Denver tomorrow, so I am not going to do anything. I'm not going hiking. Well, thank you so much for the opportunity to present the Regional Planning Commission's proposed FY 2019 budget. I will follow the same suit as Ms. Ogden did with the previous budgets by highlighting our budgeted revenue, expenditures, and some of the highlights that are contained within our proposed budget. Overall, for the organization, we are projecting revenues of $27 million, $496,786, with budgeted expenditures of $27 million, $355,524. A few things to highlight about just the organization as a whole. This budget does accommodate 5 funds, which includes about 100 different contracts that the organization has, focusing specifically in 8 program areas. We are, for those that are new to the county board, we are primarily grant-funded organization with both federal and state funding. So that makes up about 86% of our overall budget is federal and state funds. For this 2019 budget, we are projecting some staffing increases, and I will explain a little bit later on some of the new resources that the organization has been able to acquire. However, given the fact that we are a grant-funded organization and we live in that world, it is always very uncertain, given things that may be going on at the state level. As you know, the last few years we went through a budget impasse, and being a grant-funded organization, that did have tremendous impact on our organization. Same thing at the federal level. Every year we deal with a lot of uncertainty, whether the Congress is going to pass a budget or a continuing resolution, or if there's going to be a government shutdown. Or any changes in priorities, both at the federal and state level, can have an impact on any of the grant funds that we acquire to provide services throughout our community. In highlighting some of the 5 funds that are part of our budget, I'll start off with the Fund 075, which is our general operating fund. We are budgeting revenues of about $14 million, $239,305, with a budgeted expenditure of $14 million, $165,240. This does represent sustained potential growth in 2019. We are, however, if you look at the executive summary that's provided to you, there are some new grants or new initiatives that the organization has pursued, some of which will be funded in 2019, totaling about $3 million of new resources that the organization has been able to acquire that will be part of our budget. And part of that is we're anticipating some growth in our transportation and planning area. Some of that are some grants that we have managed to acquire from the Illinois Department of Transportation. But also, we have been in negotiations with Ameren to provide some assistance to them in some of the energy efficiency work and doing some planning around that. So in total, from our transportation and planning initiatives, we are projecting an additional $1.2 million in new initiatives in our 2019 program year. Again, staffing levels are projected to increase given some of these new resources that we're bringing into the organization. I do want to point out that, and this is something that we're very proud of, and that is that our administrative costs are less than 7.5% of the agency budget. This is less than the threshold that is allowed by the state of Illinois, which is at 20% of admin, as well as less than what the federal government threshold, which is 15%. So we're very proud of the fact that we're able to keep ours lower than both the federal and state administrative thresholds. In terms of our fund balance for this Fund 075, we are projecting a fund balance of $766,019. Now again, given that we are a grant-funded organization, almost all of our grants are on a reimbursement basis. In other words, we have to incur the expenses before we get paid by both the federal as well as the state government. So in some cases, we do experience timing issues where, we're not getting paid in a timely manner. We have to make payroll, we have to continue with services, and so it's prudent for us to maintain a fund balance so that those things can be fulfilled. Moving on to our Early Childhood Fund, Fund 104, we are projecting revenues of $9 million and $54,356, with budget expenditures of $9,033,809. This fund represents a blend of both federal and state funding. Our state funding comes from the Illinois State Board of Education, and our federal funding comes through the Office of Head Start, which is housed in the Department of Health and Human Services. This allows us to provide comprehensive full-day child development services to over 576 families throughout Champaign County. Some of the new funding that we have received, some of which we've received from the Department of the Mental Health Board, will allow us to provide some additional classroom support, particularly to provide support to some of our children that may have some behavioral challenges. So this is a modest growth for our Head Start and Early Head Start that we are projecting in fiscal year 2019. Our fund balance for this Fund 104 is $2,036,346. This does allow us to, so I think one of the other agencies explained that in the event that, let's say, we had to shut down for whatever reason, we would have to pay out not only some of our unfunded liabilities, but would have to, vendors and other folks that we work with for the next 6 months. But it also allows us to have resources available to do any infrastructural improvements. And so one of the things I will share with you is that one of our facilities that we have in Champaign, which has been a partnership with the school district for the last 20 years, that lease will be expiring, I think, in 2023, and the school district has expressed interest in wanting to use that facility for their own early childhood services, and so we are looking for a facility, preferably in the northern Champaign area. So our fund balance represents what I've pointed out, as well as some of the infrastructural needs that we have. I will also say that typically, particularly with the Illinois State Board of Education, for the last couple years or so, it's been, we haven't been getting reimbursed in a timely manner. And so having this fund balance allows us to keep services, keep serving our families, as well as paying our staff that are serving our children and families through this program. Moving on to our Workforce Development Fund, which is Fund 110, we are projecting revenues of $3,879,125, with budgeted expenditures of $3,865,475. This does include the new initiative that I presented before I believe it was a committee of the whole a couple weeks ago, which is a new project funded through the U.S. Department of Labor. It's our Reentry Workforce Development Program. It's a 39-month project funded at $1.5 million to work with the youth between the ages of 18 and 24. This will allow us to provide increase in staffing, given that it's a new initiative, and we're going to be working with, I believe it's 188 youth, and so we'll be hiring additional staff for that. But again, some of these grants that we are seeking are in response to the focus that the federal government is having, particularly as it relates to workforce development. We'll also be doing a lot of business engagement because part of what we do in workforce, besides working with job seekers, is actually engaging businesses. And so part of our focus in the next few months will be engaging our businesses so they can take advantage of the resources that we have through our workforce development program. The other thing to highlight that we're doing, which is part of our strategy with this initiative, is we are in the process of conducting a labor shed study so that we have a better understanding of the workforce needs that our employers have, but as well as the employee characteristics that we have in our 4-county area. So with this program, for those that are new on the county board, we serve 4 counties. Besides Champaign County, we're in Piatt County, Ford and Iroquois counties as well. The fund balance that we are projecting for our Fund 110 is $18,000, so it's a modest fund balance, but it's $18,622. Moving on to our loan programs, this is our Economic Development Fund, Fund 475. We are projecting revenues of $114,000. This is primarily coming from interests that are paid on the loans that we have loaned out, but also budgeted expenditures of $261,000. And Chris will help me if I veer off here, but this is to help pay off some of the bad loans, canceling bad loans.
Right.
Okay.
In some cases.
In some cases. But this fund accommodates a restricted revolving loan portfolio. And with a lot of these loan programs, we are required to, we do require those that we provide loans to create jobs. So there are jobs tied to the loans that we make through this program. But again, it's to help to improve it. One of the things that we're hoping for, as well as the economy is doing, that we will have more demand for our loans, and so we can make more loans throughout our community. And so we're hopeful that with the economic conditions improving, that we'll be able to do more loans. So an anticipated disbursement of over $250,000 is what we're anticipating in FY 2019. Now, we do have a fund balance of $7.2 million, and I want to explain that. And again, I will lean on Chris, our fiscal manager, to help me if I don't state this correctly. This does not all represent cash. Part of this does represent the long-term reimbursables that are not cash. Half of it is actually not relendable. I will say that about maybe $3 million or less of that is cash, and most of that is restricted. We had a loan program that was funded through the Community Services Block Grant. It was a revolving loan program that had been in place statewide, not just restricted to RPC, but statewide for over 30 years. The federal government came in and did a monitoring visit of the state of Illinois and challenged whether the state of Illinois were within the statutory provisions of the Community Services Block Grant to actually have a revolving loan program. There has been no resolution to that issue. The loan program was suspended in 2014, and there have been efforts, including ourselves, working with the state of Illinois and the federal government to come to some resolution on it. But as a result, we are still holding the funds that were the repaid principal as well as the interest generated from the loans that we did through the Community Services Block Grant Revolving Loan Program. So that sort of explains the fund balance that we have that is part of our Economic Development 475 fund. The last one is our USDA Loan Fund, Fund 474. Budgeted revenue projected at $210,000 with budgeted expenditures of $55,000. This is our IRP Intermediary Revolving Loan Program that provides low-interest loans in the rural areas with a population of less than 25,000 individuals. This program, loan program, helps us to promote economic development activities, again, tying it to job creation. We're including an estimated disbursement of over $200,000 in new loan activity in FY 2019. The fund balance for this is $1,053,244, and I believe out of that, probably about $200,000 is what we have in cash. Before I conclude the presentation, I do want to refer you to one of the memos I believe may be included, and this is a memo to the county board just to highlight some of the resources that we do receive from the county and what those resources are for. So for the FY 2019 budget, first is to report to you that for a number of years, the Regional Planning Commission did have a planning contract with the county, but from effective January 1st moving forward, those planning activities will now reside with the Champaign County Zoning Department. This was as a result of an internal assessment that we did, a cost of benefit analysis, and I think we believe that by having those services provided by the county zoning department, it will help to streamline some of the county planning activities and make it more cost effective. The other thing is that to highlight some of the membership dues. So for the RPC membership dues, Champaign County's portion is budgeted at $20,670. This is a 0% increase from the prior year. The due structure consists of a base and per capita contribution utilizing adjusted census data. For our QOTS, our MPO, the Champaign County support for that is through the Highway Department, and that totals $31,948. This represents a 5% increase from the previous year. These matching funds that we do get for our QOTS does help to support any additional federal dollars, so they're used as match for federal dollars that we do receive for all of our transportation planning, engineering, and research that we do. The other funding that we receive from the county is for the Youth Assessment Center. That is budgeted at $242,500, which is an increase in 2.5% from the previous year. I think we all know what we do with the Youth Assessment Center. And then the last one I'll highlight is our police training matching funds, which is budgeted at $9,829, and this represents a 5% increase, and I believe this is paid for through the sheriff's budget.
Correct.
Yeah. With that, I guess we'll take questions that you might have on our.
Thank you. Questions, Mr. Anderson.
Yes, there was mention earlier about a energy efficiency database development program, and I think you said it may be related to Ameren.
Yes.
Is that up and running, and how will that function?
So Ameren, which is one of our regulated utilities, they, alongside the other utilities, I think about 2 years ago, there was a major bill that was passed in the General Assembly, and the governor signed it into law. Among other things, what this does is generate some resources for energy efficiency work to be done, not only for residential, but also for commercial and industrial buildings. And so Ameren, in part, what they have done is they've set aside some resources to do some community-based initiatives. And they'll be working with a lot of community-based organizations to either get individuals interested and trained to do energy efficiency work, or in our case, for Champaign County Regional Planning Commission, we're actually looking at, we're developing a project that will focus in the Garden Hills area, where we'll do a lot of energy efficiency work in that area. So this database project is to help Ameren track all the indicators related to these special projects that they'll be working with all these community-based organizations throughout their service territory. In meeting with them, they wanted to leverage some of the expertise that we have on our staff to help them realize some of their goals. And so using the expertise that we have in our in our planning division, we have developed a database. It's not up and running yet because some of these projects that they are developing with some of these community-based organizations have not been fully developed yet. The goal is to probably have this fully running for the next 4 years, beginning in 2019. Yep.
Other questions? Ms. Petrie.
Thank you for being here this evening. My comments will be very similar to those on for the Mental Health Board. We're a very unique county in the fact that we have an RPC and we have a Mental Health Board and we have a Public Health District and we have a County Health and we have a Housing Authority. And once upon a time, I took a big yellow sheet and looked at the overlaps of these agencies and their programs. And so I continue with that concern that there are these overlaps. Structurally, I acknowledge it's very difficult. Sure. You're grant funded, others are statutorily driven. So I'm laying that out as a caveat. Having done that, it's still grant monies, which is taxpayer money, no matter any of those agencies. And I continue with my concern of how can we in this county break down some of that siloing that exists, and everybody really does acknowledge we have siloing here for all those reasons. And how can we start breaking those down so we can better collaborate and stretch those dollars to serve more of the many programs that you all serve, Mental Health Board, on and on and on and on, there are huge needs in our whole county for those. So I hope as you all work together and the RPC board thinks through some of these things, and maybe you're a big agency, you have a huge budget, larger than all the others, do that some bridge building can be done, and in some of those areas, how can leveraging start to happen? Primarily, I have a major concern on mental health. And as I said, when Lynn was here, we all acknowledge that's a huge need here. And the workforce development that you mentioned and how that dovetails with what the Housing Authority program is. So thank you.
That's actually a very good point. And I think, perhaps with some of the new leadership that you're seeing in our community, I think we may be seeing a lot of collaboration among our organizations, because clearly as an agency we can't do everything. And we have to not only leverage, but we have to collaborate with other organizations that have expertise in certain areas. And so you mentioned the Housing Authority, and I know he was here a couple weeks ago. We actually are in discussions with the Housing Authority to partner on the Youth Build initiative that he talked about, but also on workforce. So that's something we're certainly looking forward to working on. Thank you.
Other questions or comments? I think that's it. Thank you very much.
Thank you.
Escape while you can. Okay, next up is solid waste management.
This was just in case. This was in case we hadn't had a break yet, but we've had that, so looks like no one's asleep.
Not yet.
The Solid Waste Management Fund, Fund 676, has revenues budgeted at $27,769 in 2019. Per the Solid Waste Recycling Coordinator, the cost to participate for local agencies for the residential electronics collection events are going to be reduced in 2019 from 2018. Budgeted expenditures in 2019 are $43,500, and the revenue to expenditure deficit represents the county's contribution to the collection events. There are two residential electronics collection events scheduled to be held in 2019 at Parkland College. And in 2019, this will be the first year under the new Illinois Consumer Recycling Act where counties or municipal joint action agencies can opt to participate in revamped manufacturers' e-waste programs. In 2019, it is expected that the Solid Waste Recycling Coordinator will propose implementation of a municipal joint action agency for disposal of household hazardous waste and unwanted pharmaceuticals and consumer electronics, including televisions. This may or may not come to fruition in 2019. However, the appropriation for expenditure does include an amount that would be the anticipated cost to the county to participate in this MJAA. And the proposed model would include all 7 RPC member agencies with membership options for other municipalities. The fund balance for projection for the end of 2018 is just under $27,500.
Questions? Mr. Storr?
It happens that I sit on the Solid Waste Association of North America Long-Term Care Committee, and I'd like to state that the problem of household hazardous waste mixed with municipal waste is one of the largest concerns among at least a portion of the Solid Waste Association of North America. And I think that we can't move quickly enough to try to keep these things out of our trash as it goes to various landfills. And I hope that we'll be able to move forward on this.
Other questions or comments? Okay, let's move on to courts construction. And Tammy, want to turn off the other microphone there? Oh. Thanks.
The Courts Construction Fund has revenue budgeted at $2,000. The only revenue for this fund is interest. Budgeted expenditure is $220,000. This is a capital projects fund for the courthouse and the courthouse addition. In the current fiscal year, there was an installation of power protection and backup for sound equipment in the courtrooms. And there's also a plan to replace a wooden handicap accessible ramp with composite material and to minimize the column bases inside the courthouse, which have been identified as trip hazards. In 2019, there are no specific projects planned at this time, but we are budgeting to allow for facility repairs if they become necessary. With the $220,000 in budgeted expenditure, the projected fund balance at the end of the fiscal year is just under $37,000.
Questions? Ms. Furtado?
And so eventually this fund will just cease to exist, and then will the courthouse then just go into the overall preventative maintenance plan?
Correct. And we do, through the Capital Asset Replacement Fund, there are scheduled plans for projects at the courthouse as well.
Do you have any anticipation of how long we'll keep seeing this fund, or just until we spend it?
It really depends on, again, you know, if there are any kind of emergency type appropriations that are necessary.
Other questions? All right, thank you. Let's move on to Courthouse Museum.
The Courthouse Museum Fund has budgeted revenue of $60, which is interest, and budgeted expenditure of $0. This fund is established to maintain a museum area with a focus on Abraham Lincoln in the courthouse, and decisions regarding projects to be funded are made by the Lincoln Legacy Committee. There are no specific expenditures planned or budgeted in fiscal year 2019. The projected fund balance is $8,721.
Questions? Okay, see none, let's move on to the public safety sales tax.
Oh, sorry. This first slide is a summary for the Public Safety Sales Tax Fund, Fund 106. Budgeted revenue for the fund in 2019 is $4.94 million, and the revenue comes from the county's quarter-cent tax for public safety purposes and also from interest income. In July of 2017, the state imposed a 2% collection fee on this tax, and that amount of the collection fee was reduced to 1.5% effective July of 2018. Year to date, this fee has cost the county $101,666. Budgeted expenditure for the Public Safety Sales Tax Fund is $4.9 million. And the fund balance projection for fiscal year 2018 is just over $2.4 million. The first budget in the Public Safety Sales Tax Fund is for debt service. And this budget is for the annual principal and semi-annual interest payments on the bonds that are issued for the construction, remodeling, and masonry renovation of the courthouse, and also construction of the juvenile detention center. In 2019, budgeted revenue and expenditure are $2.32 million. 47% of total public safety sales tax revenues are budgeted for debt service and interest payments. In 2019, there are 3 outstanding bond issues, and the public safety sales tax bonds will all be matured by the end of fiscal year 2028. The next budget for public safety sales tax is county board. Budgeted revenue is $2.62 million, and this revenue is the remaining public safety sales tax revenue that's not budgeted for debt services. It's receipted into this budget. Budgeted expenditures are $2.3 million. Included in this budget are the reentry program, which the county has a current contract that goes through June 30th of 2019. And so that amount that is committed is $50,000. The budget does include $100,000 for either the extension of the current contract or it otherwise directed by the county board. This budget also includes a transfer to the Capital Asset Replacement Fund of $658,761 for criminal justice system technology and equipment, and a transfer to the general fund of $1.48 million for utilities and minor maintenance cost of public safety buildings, the salary and health insurance costs for the jail classification system lieutenant, and also to offset MetCAD costs in the sheriff's budget. And this is a new, the $587,000 that is budgeted to offset MetCAD cost in the sheriff's budget is a new transfer. And the reason that that was facilitated in 2019 is to allow for the county to be able to comply with its 10-year capital plan, which requires $1.12 million in funding for maintenance and repair projects scheduled in fiscal year 2019. This budget also includes a transfer to the Specialty Courts Fund for the salary and health insurance cost of the Specialty Courts Coordinator. Justice System Technology has no budgeted revenue and budgeted expenditure of $30,000. This pays for a portion of the annual maintenance cost for the Justice System Technology, or JANO, which is also partially paid for from the Courts Automation Fund. The reduction in expenditure in fiscal year 2019 is due to the software maintenance cost for the current jail management software being moved to the Capital Asset Replacement Fund in fiscal year 2019 with the planned implementation of the jail management software as a service contract. And that those costs are included in the $658,000 transfer that I mentioned with the last budget. And the last public safety sales tax fund budget is for delinquency prevention grants that Mr. Solomoya mentioned earlier for the Youth Assessment Center. Budgeted revenue is $0. Budgeted expenditure is $242,500. And the 2019 contribution is based on a 5% projection of 2018 revenues. I will note that the amount that was budgeted in 2018 included $15,000 to assist the Youth Assessment Center with relocation costs to its new facility. So that's why there's a reduction in the amount of the budgeted expenditure in fiscal year 2019.
Questions? Ms. Furtado.
So just to make sure, on the delinquency prevention side of it, that $64,063, which wasn't expended, is not going to be expended at the end of 2018. We're just leaving that in fund balance until there's a one-time expense for that.
Oh.
Is that what, am I understand, like, that's not being appropriated, that's just something we're
Correct.
leaving in fund balance? But if, say, in 2019, there was a one-time expenditure that would apply to that money, we could go back for it? Is that how you're anticipating?
There would, a budget amendment would be required since we're not appropriating for it.
Okay, but that money is not intended to be part of keep making the fund balance more robust. That's money that
It is
there.
part of the fund balance, but it is, specifically identified as fund balance that would be for one-time costs
Gotcha.
for delinquency prevention.
Okay, I just want to make sure I understood that. Okay, thank you.
Other questions? Okay, let's move on to capital asset replacement.
This slide is a summary for the Capital Asset Replacement Fund, Fund 105. Budgeted revenue in fiscal year 2019 is $2.65 million, and budgeted expenditure is $3.31 million. This fund is to receive revenue and appropriate expenditures for long-term capital planning, technology, vehicles, and equipment and facilities. The 2019 budget process resolution that was approved by the county board directed that this fund be prepared utilizing all available general and public safety sales tax revenues to prioritize the county's technology and facility needs. And so in 2019, this budget includes reserve funding for items that are scheduled for future replacement. This is something the county has not been able to do for approximately 10 years, I believe. So what that means is historically, the county has prepared its budget to include current funding only for items that are scheduled for replacement in the current fiscal year, and also for current funding in addition to reserve funding for a portion of the costs for items that are scheduled for replacement in future fiscal years. Because of restricted revenues, we have not been able to fully fund capital asset replacement fund. And so in fiscal year 2019, we are able with this budget to put aside reserve funding for the items that are rescheduled for replacement in future years. So for example, if there were a vehicle that was estimated to cost $30,000 and it was scheduled for replacement in 5 years, the county would put aside $6,000 in fiscal year 2019 to fund a portion of that vehicle, and in a period of 5 years, we would have full funding for that vehicle. That we have not been able to do, and we are able to do that with the fiscal year 2019 budget. Capital Asset Replacement Fund for software. This is where I just want to talk a little bit about what dollars are going towards software in fiscal year 2019. So the planned replacement of the real estate cycle system, which is currently an in-house system on the AS400, is included in the budget. Also, jail management software as a service contract. The county is one of only 3 clients that is using the current system, which there already is some support that has ended for it, and the system will be fully unsupported in the near future. We don't know the exact date, but there is appropriation in the budget for this software for jail management. Also, law enforcement, civil processing, and business office software as a service. If you remember with the 2018 budget, the county had appropriated for replacing the county's financial and HR system with a software as a service contract, a basic, level software as a service contract. We have not moved forward with that this fiscal year, and as I mentioned earlier, we do plan to prioritize the real estate cycle system replacement in 2019, but we are planning to reappropriate the funds that were budgeted in the current fiscal year in 2019, so that if the county is able to start on that project after it completes the real estate cycle software implementation, that it would be able to start that process. The 2019 budget includes implementation of a 24/7 information security operations center to enhance perimeter security. And this will better help protect the county from virus outbreaks like the one that it experienced earlier this year that affected over 200 computers at the courthouse and I believe at JDC. There are expanded utilization of the Microsoft Azure cloud services, and also planned replacement of the unified messaging solution to replace the county's obsolete voicemail and phone answering system. Software also includes the Microsoft Office licensing and specialized software for general fund departments. And then per the county board's direction, there is $50,000 for racial justice task force recommendations, which in discussions that I have had with certain leaders on the board may look like an open data portal software system. And so presently, the appropriation for this is sitting in the Sheriff's Capital Asset Replacement Fund. However, there have been some ongoing discussions between Finance and Justice and Social Services leadership and Chief Deputy Alan Jones that have led the county to understand that there may be some state portal options that could become available to the county. So it's possible that this $50,000 may have to be moved elsewhere in the budget, but at this time it is appropriated per the direction of the county board for recommendations of the Racial Justice Task Force. And the last budget in the Capital Asset Replacement Fund is, I'm sorry, this isn't a budget. This is just a summary of the FY 2019 facilities funding. In May of 2018, the county board approved the 10-year capital facilities plan, and that plan called for $1.12 million in fiscal year 2019. And you can see at the right of this slide that I have identified what the required facilities funding is per the 10-year capital plan. And I just want to note that these numbers do not include the nursing home, the sheriff's downtown facilities, and they do not include any interior improvements such as paint and carpeting. So you can see in fiscal year 2021, or I'm sorry, in fiscal year 2020, there's another $1.1 million that the county, if it is to continue to comply with it, its facilities plan will need to find in dollars to invest for facilities. In 2018, the county appropriated just over $261,000 for the county to either proceed with the ADA improvements that were required through the county's settlement agreement with the Department of Justice, or to begin planning for vacating the downtown facilities. We have not yet expended those funds, and so we will be reappropriating those in 2019. And the anticipation is that the County Facilities Committee will resume discussions regarding the county's plan for its downtown sheriff's facilities.
Questions, comments? Let's go with Mr. Storr first.
Thank you. Going back to the software, when will the final conversion, could you tell us a little bit about the anticipated conversion as we migrate off of the AS400 and the obsolete software?
Well, this is a process that's going to take time. I mean, as I mentioned, we're moving the jail management software, we're moving the sheriff's business office software off of the AS400, we're moving the real estate cycle system off of the AS400. As you heard earlier, the animal control still is using the AS400 for their operations, and we have the financial and HR system still on the county 400. So it's, we are making major progress in 2019, and the anticipation is that we will continue to make progress in 2020. But beyond that, I really can't say. I think JANO still is utilizing the AS400. And at this time, there are no specific plans for JANO to be moved off of that. I don't know that it can be moved off of that.
Thank you. I'll just remark that that the reason that some of that the virus didn't hit some of our critical facilities was because they were being operated on a mainframe computer that was too old to be infected. It's ironic.
Ms. Petrie, you have a question?
Yes, I do. Page 99, and it's 5332, it's architect services. And where did that number come from that you have in the budget?
The 261,113. That's the money that I was referring to when I said we were reappropriating the amounts that were budgeted in 2018 for either the ADA improvements that were required at the downtown facility or planning for vacating those facilities.
Well, if we do anything to downtown, it's going to cost more than that. So this is purely bringing in an architect if we have to look at what needs to be done. Is that what you're telling me?
Architect and engineering services, and this amount is not enough to engage those services. The county will probably have to add additional dollars to that. But yes, if the county decides that it is going to vacate the downtown facilities, this would be, a preliminary amount that it could use to be able to proceed with planning for that.
Okay, but there's nothing in the budget in relationship to any architectural services for the satellite, is that correct?
What do you mean to the satellite?
Well, if anything is done to the satellite, there still would have to be additional architectural services to do that.
Are you talking about an expansion at the satellite?
Well, if the downtown gets closed, then something's going to have to happen to the satellite. And this amount, is that to cover that, or will then there have to be an amendment to the budget to handle those services?
This amount would need to be added to in order to have enough appropriation to engage the soft cost for architectural and engineering services.
Ms. Furtado.
Can you just remind me the amount of the ERP software?
The amount that was budgeted was $272,000. Again, that's like a base model.
And that doesn't get us quite to what we would need?
Probably not. I know when Mr. Snyder was here, he had worked with a software company to come up with those numbers, but there hasn't been a comprehensive needs assessment conducted yet. So it would be difficult to say, but I doubt that that would be sufficient.
So it more than likely is going to trail into 2020, that part of it?
Yes, I think it will be in 2020, but there is funding available for the county to start on that project.
Mr. Basapati.
Yeah, sorry, I'm sure some of this has been discussed on the board before. But in terms of the software as a service, these are the transition costs of the software as a service, not the sort of long-term cost of running it?
So for the jail management system and the sheriff's business office system, in year one, they do include one-time costs. For the jail management system, the company that we're utilizing is allowing us to split the one-time costs with the exception of travel between 2 years. And so that was an incentive to the county. And then, of course, the travel will be paid for in year one. If I remember correctly, the ongoing costs for the jail management system software were about $102,000. And then for the business office software, roughly half of that $74,000 is for one-time costs.
Okay, and is there, if this company goes out of business in 5 years, is there sort of, are we just, stuck holding the bag, or?
So the company that the sheriff's office is planning to use is Tyler Technology, and they're one of the largest software companies that provides these services.
Okay, thank you.
Mr. Anderson, are you scratching your head? Okay. Okay, all right. Seeing I can't get anybody else to ask questions, let's move on to the IMRF and Social Security.
This is the county's Illinois Municipal Retirement Fund. It's Fund 088. Budgeted revenue for this fund is just under $3.8 million in 2019, and budgeted expenditure is $3.35 million. Due to strong return on investments, IMRF has notified the county that its rates for 2019 will decrease. And this will allow the county to use additional appropriation authority for the IMRF levy to be reallocated to its general fund and its liability fund levies. One of the things that we have talked about is the IMRF obligations of the nursing home, which historically are reimbursed to this fund through the issuance of a tax anticipation warrant at the end of the fiscal year. And with the planned sale of the home, this is going to leave the outstanding IMRF obligations for 2018 sitting within this fund. At this time, those are estimated to be just under $450,000. And as I said, these will be unreimbursed at the end of the year. And so what the county has proposed to do for the 2019 IMRF levy is to reallocate a portion of the nursing home's operating levy for the outstanding obligations of the home associated with fiscal year 2018, and so that this IMRF fund can be reimbursed for those outstanding obligations.
Questions? I see none. Go on to Social Security.
The Social Security Fund, Fund 188, has budgeted revenue at $3.128 million, budgeted expenditure at $2.693 million. And again, the planned sale of the nursing home leaves the outstanding Social Security obligations for fiscal year 2019 unreimbursed. Those are estimated to cost $435,500. Again, the county will not be able to issue a tax anticipation warrant against the nursing home operating levy in 2019. So the plan is for the Social Security levy to have a reallocation from the nursing home operating levy for the outstanding obligations of the nursing home's 2018 FICA costs.
Questions? Seeing none, moving on to tort immunity and self-funded insurance funds.
The Tort Immunity Fund, Funds 076 in 2019, has just under $2.5 million in budgeted revenue and $2.26 million in budgeted expenditure. This is a levy fund budget, so there is an additional almost $89,000 in property tax revenue in the event of a favorable ruling in the hospital property tax case. As I mentioned earlier, appropriation authority that was not required for the IMRF levy has been reallocated to this fund in order to help improve the negative fund balance, which you can see is just over $1 million, and also to help pay for the expected increases in the county's workers' compensation rates. In 2019, the liability levy includes $439,285 that has been reallocated, and this is the remainder of the nursing home operating levy that was not reallocated for IMRF and Social Security obligations of the home. This $439,000 has been reallocated from the nursing home operating levy for part of the outstanding obligations of the nursing home, which I will describe in a minute. And then there is a expenditure transfer to the self-funded insurance fund in an equal amount. As of June 30th of this year, the nursing home fund owed the self-funded insurance fund just over $691,000 for workers' compensation costs, property insurance premium payments, outside attorney fees, and interfund liability billings. So this $439,000 will not make self-funded insurance fund whole. And it is anticipated that those amounts that are going to be owed are going to continue to increase as we move further into fiscal year 2018. One thing I want to mention about the fund balance is that the negative fund balance is offset by the self-funded insurance fund balance, and we anticipate improvement of this fund balance as the levy allows for revenues to exceed expenditures. And we have seen some improvement in the last few years in this fund balance. The self-funded insurance fund, Fund 476, has budgeted revenue of just under $3.1 million, budgeted expenditure at $3.12 million. This is the fund for the county's auto liability, property, general liability, unemployment, and workers' compensation claims, payments, and stop-loss insurance premiums. A biennial actuarial study is conducted to provide an estimate of unpaid claim liabilities and projected amounts that are required to fund the county's retained exposures. The increase in expenditure in fiscal year 2018 and 2019, it results from anticipated payment of claims that have been incurred by the nursing home. The fund balance projection is $4.37 million at the end of fiscal year 2019. And when combined with the Tort Immunity Fund, the balance is $3.36 million. Just so you know, the estimate of unpaid claim liability per the county's actuarial study for the period ending December 31st of 2019 is $3.9 million.
Questions, comments? See none. Tim, any final comments?
I'll see you tomorrow night.
Right. Ms. Petrie, you have a question?
No, but I would like to read Jeff Blue's answer into the record. And
What was the question first? Repeat the question.
the question had to do is building maintenance permissible using the motor fuel tax, and the answer is yes, according to the statute. And if anybody wants the statute, I can forward it to them. I have it.
Okay, thank you, Ms. Petrie. Okay, seeing we have no other business, we'll see you tomorrow, same bat channel, same bat time.